talk about what everyone is talking about, monkeypox. There have been around 3,000 cases so far, Dr. Kohli, and it's spreading apparently to more and more cities. Over the weekend, the World Health Organization declared monkeypox a global health emergency. So in your medical opinion, should we be worried? Is this another pandemic or no?
You know, this is the highest level of alert from the World Health Organization, and it's time to wake up and take this seriously because the WHO doesn't do this every day. In fact, since 2009, they've only done this 7 times. The last one was COVID-19. So what they're saying basically is that we need to pay more attention. We need more resources. We need to act more aggressively. And this is an early warning sign that the cases, which are now almost 3,000, are spiraling out of control now.
Oh, Lord, I'm so worried about this. All right, a lot of the reporting about monkeypox focuses on how it is spreading mainly in the gay and bisexual arena. I say that carefully because I want to ask, does that mean it can't affect us all? And do you think this characterization of that is somewhat dangerous?
It does not mean it can't affect us all. It just happened by chance that it happened in the homosexual community. It could have very well happened in the heterosexual community.
Right.
And I'm really worried about this messaging because I think heterosexual people are taking this as this is a gay person's disease. That's the mistake we made with the HIV epidemic in the 80s, where the messaging actually hurt our efforts to try to control the disease outbreak. And now we've seen 2 cases in children, and that should prove that anyone, no matter what age, what gender, what race, what sexual orientation, can get monkeypox with skin-to-skin contact or droplet transmission.
That's so important to know.
Okay, I want to move on to another big conversation right now, a big concern in America, I should say, the obesity epidemic. According to the CDC, a whopping 42% of America falls into this category. That's more than 140 million Americans. I had to double check that. 140 million Americans dealing with obesity. Now, for so long, it was considered a personal failure. Now we're starting to see it, you know, people just saying that person's healthy no matter what. What is your medical opinion on that?
So obesity is a disease. It is not a personal failure, and I'm so glad that we're finally waking up to that reality because I think it's going to help open the door for the conversation that we need to have on how to treat this disease. Obesity can be because of system-level failures, so it can be that the system failed you. You don't have access to food, you live in a food desert, you can't afford healthy food, you don't have time to exercise because of your job. It can be because of biological reasons, genetics, your metabolism. You can have conditions like hypothyroidism where your thyroid is underactive and can make you obese. It's an intersection of your biology with your circumstances and your behaviors that leads to the obesity as a condition. But it's a disease. It is not a personal failure, and we need to acknowledge.
It's hard to convince people of that.
It really
Just like
is.
It's hard to convince people that drinking is the disease or gambling is a disease or sex addiction
or shopping addiction.
It's hard for people.
Why do people take it so personally? Why is it the perception that if somebody talks to you about being obese, that is an attack on you, your character? It's because we've characterized it as such. If I tell you you have hypertension or high blood pressure or high cholesterol, would you react that way?
No. It's not so sensitive in any way.
But how do you equate someone that may be plus size or overweight, but they're maybe healthy? Like Lizzo claims she's very healthy. Lizzo claims she eats a plant-based diet. She works out every day. Is there exceptions? Go ahead.
There comes a time when age factors into this, right? You might be 20 and be quote unquote obese or plus size, whatever we want to call it. When you're 40, things are different, right? Things start clogging up a lot faster. But we're promoting this at a young age. So you're not looking to transition at any point from 20 to 40. You're like, everyone told me I was cool and this is all good. It's like giving a kid cigarettes and say, you better stop before you're 40, otherwise it's going to catch up. It's not good, the message we're sending, Doc.
You said it perfect, and I'm going to call you Dr. Schroeder.
Okay.
Does that mean I lose mine?
Yes. You never had one. You never had a medical degree.
3 doctors.
So when I talk to you and when we agree, I'd just say I concur?
I concur, doctor.
Okay.
Yes, you're exactly right. So there is actually data on this. The American College of Cardiology has looked at people who are obese but quote-unquote metabolically healthy, meaning that they don't have anything wrong with their numbers or their risk factors today. But then they follow them over time, and their risk for heart disease is 49% higher. Their risk for stroke is higher. Their risk for problems down the line is higher. So it's not what your snapshot of health is today, it's what it means for you in the future. And obesity is a risk factor for disease, for cancer, for heart disease and death.
Wow. All right, let's talk about this, because this is a big discussion we've all had in our personal lives. Big is beautiful. Let's just call it what it is. That's a movement. Singers, like you said, Lizzo, models, they're all talking about acceptance of being plus sized, right? In fact, yesterday we had Hunter McGrady. She is a plus size model from Sports Illustrated. We want you to see what she said and then respond. Take a look.
People comment on my posts being like, oh, you're promoting obesity and this is a health risk, health problem. But my medical records say otherwise. I've been also, again, a size 2 where I was the most unhealthy. I mean, I bruised like a peach. I was always tired. I had dark circles under my eyes. So really, that is such a stigma that I wish would just change completely.
So what is your response to that and big is beautiful? So medically, of course.
From a medical perspective, she's saying a couple of things. One is that there is a U-shaped relationship. Too thin is bad. It increases risk. But too heavy is also bad. We have to acknowledge that. We cannot say one or the other. It's not black and white. It's the Goldilocks middle zone. That's where we all need to be in our ideal body weights. And the second thing that she said is that today I'm healthy. And that goes back to what Jeff brought up. Today her numbers might look good, but being that weight will increase her risk for multiple conditions down the line. So, the big is beautiful thing started out with the best intentions, because there is sizeism, there is weight-related discrimination, but I think it's spiraled out of control now, where big is beautiful may be true, but big is not healthy. We need to stop conflating health with beauty, because they're not the same thing.
It's hard to talk about, Doc, because you get into the fat shaming thing, and I'm at this age, I'm 45, where I understand kind of both generations. I've seen people as we grew up be attacked for their weight, be just demonized, and so I get where this movement came from, but also the starting center of my high school basketball team passed away 42, 41, because he had a quadruple bypass and died at the hospital. So I've seen, and he was overweight. He did not have a good diet. So how do I talk to people that I care about, that have been attacked?
Like sensitively,
my female friends, my female, family, and the people I want to be alive and be happy and thrive, but also not shut down what I'm saying immediately because they think I'm attacking them. So
how do you say you're beautiful, but we just want to make sure that you're healthy too?
Yeah, you don't get that backlash if you're like, hey man, maybe you should quit smoking. They're like, yeah, I'm going to think about it, right?
Yep.
You kind of shrug it off. But if you say something like, hey, I love you, and then really, let's be specific. It's who we care about. Right. I don't care what people I don't know do with their life. You could do whatever you want. But if someone in my life, I want to say something to them and try to help them out as a friend, as I would, hey, maybe you should stop smoking. How do you get that across without being fat shamed, or then you're labeled as something?
There's two people in the conversation, you and the person receiving it. So you have to be careful. You control what you say without judgment, without blame, without holding them to any kind of expectation or standard. So that's what you can control. But I also think the person on the receiving end has to change the perception. If somebody talks to you about smoking, you don't think of it as a physical judgment. But the minute that somebody says you put on a few pounds, we need to get you back in shape, you think they're judging you physically. So I think our culture as a society has to change so that people who are receiving this information say, oh, it's just somebody talking about my health. It's not about how I look.
I think it's better to get it from a doctor. Maybe you just say, let's go get our physicals.
Let's do it together.
Aren't there there's situations where you can, excuse me, in your patient chart, say I don't want to talk about weight in certain
or not get weighed.
Not get weighed or not talk about your weight, which I was shocked when I heard that.
I had a patient who wrote an angry email to me because I put obesity in the list of problems that we needed to discuss. So the doctors are starting to also worry about being fat shamed, but I would say let's get empowered. Let's take this as a wake-up call. With 4 out of 10 Americans being obese, we got to change the trajectory of things.
I mean, what was it, 140 million Americans? Wow. Okay, Dr. Kohli, we appreciate you. Thank you so much for chatting with us. If you have a question you'd like our Dr. Kohli to answer, write us on social media or email at info@dailybosslive.com.